Hello, I'm Dr. Dave Schwartz, Team Chiropractic, here for our Strain, Sprains, and Extremities workshop. Extremities are a big thing of what we do here at Team Chiropractic. One of the things I think that really sets us apart from a lot of other practices. All of our doctors have extensive postgraduate training on the treatment of extremities, so let's get going. We have kind of two main types of acute extremity conditions. You got your strain, which is of course a muscular condition when a muscle is stretched and torn, and then you have a sprain, which is when the ligaments are stretched and torn. We go on probably the most common type of sprain that we see is that sprained ankle. Most of us have experienced those. I certainly have. Very common injury playing sports. You have two main kinds of those. You have the inversion where that toe or foot kind of rolls in. That's the more common one. Sprains the muscles or the ligaments, on the outside of the ankle. And then you have the eversion where that toe kind of rolls out and you sprain the ligaments on the inside of the foot. The sprains are divided into three types. You have the type 1, which is kind of the most minor injury. It's just a stretching and really a small tear. Those are pretty minimal injuries. You typically can still walk on them and still use them. You may have to rest just a little bit. Then we go into the more common type 2. For these, you usually have to rest for about 24 hours before getting back on them, but we do encourage people as soon as we can, once you've gotten seen by a doctor in our office, we try to get you back into at least light activity as quick as we can, because that promotes the fastest and the best healing. Finally, you have a type 3 sprain, which is the most severe. Well, that's when that ligament is completely torn. They can take much longer and be more difficult for sure. Then we go into the strains, which is the muscle injury. One of the most common we see here is of the shoulder and particularly of the rotator cuff muscles. They can happen both in an acute setting, commonly if you fall with your arm outstretched, it's a common thing to tear one of those rotator cuff muscles. Then you can also get those from overuse, particularly if you do a lot of use over your head. Those muscles and the tendons can actually begin to wear, especially as we get older. More common in people over 40, because those of us who are in that over 40 club like me, we get a little less blood supply to that shoulder. We're more likely to have those chronic shoulder injuries. The more chronic extremity conditions, we're going to run through some of them. Kind of the main general one, tendinitis can happen at any tendon. The tendon is kind of that end part of the muscle that actually attaches to the bone. When they become inflamed due to overuse, can happen anywhere. We're going to talk about some specific types going forward, but they can be very uncomfortable, typically require some rest. And then of course you want to get in here as soon as you can to get treatment for that. Golfer's elbow, also known as medial epicondylitis. That's going to be pain kind of on this inside part of the elbow. It's common in golf. Any type of activity though where you have rapid flexion of the wrist. Baseball players, particularly pitchers, can get it. Some people get it, at work if they use a certain kind of tool that's very wrist intensive, can develop that pain on that inside part of the elbow. Then we go sort of to the opposite side of that. We go to the tennis elbow, which is a lateral epicondylitis. That's pain out here on the outside of the elbow. Frozen shoulder is another common thing we see, also known as adhesive capsulitis. That's when you really lose range of motion of that shoulder. Instead of being able to go all the way up with your shoulder, people tend to be limited below 90 degrees. And that's a thing that can be progressive and just kind of get worse and worse and lose range of motion the longer it's there. So it's really important if you start noticing a loss of range of motion in the shoulder, or if you know someone who has loss of range of motion in the shoulder, we want to get them in here as quickly as possible and get that shoulder worked on so we can begin to break that up. Runner's knee is another common injury that we see, also known as patellofemoral pain syndrome. It's real common in anyone who runs a lot. Also jumping sports like basketball and volleyball are very prone to this. Basically what happens is that kneecap or the patella sort of shifts one way or the other, usually to the outside, and gets out of its normal track. You can begin to get some crunching and grinding when you bend over, like if you do a squat or if you just move that kneecap around, you can feel a little crunch in there and that cartilage is starting to wear away. Can also cause a lot of pain. And that's something that typically we'll go through when we talk about the treatment for all these injuries that we want to see. We see that very commonly. A big one we see a lot also is plantar fasciitis. That's when you have inflammation of the plantar fascia, that kind of tough material at the base of the foot can be very painful, especially when you first wake up. Usually that first step in the morning when you get out of bed is very painful. Then it usually eases off a little bit, but again, we'll kind of come back if you're on your feet for a long time, particularly if you're on your feet on hard surfaces, working on a concrete floor or walking outside, things like that. It's very important when we see that, because anytime you have a problem in your foot, it's not only going to cause foot problems, it's going to affect the way you move, it's going to affect your gait, which in time leads to knee problems, hip problems, low back problems, and really all the way up what we call the kinematic chain. So that foot problem is where it'll start, but it can cause pain and problems all the way up to the top of your spine. So it's always critical that we get that fixed and addressed as quickly as we can. It's also one of the things we find in people whose lower back problems don't respond as quickly as we can. A lot of times there's a foot problem underneath that's underlying that we need to address. So treatment for all these injuries, there's going to be some fairly consistency with all these. And I think the big thing, if you go, with a sprained ankle to the typical medical doctor or the urgent care, you're going to get pain medication and you're going to get probably a cortisone shot, an anti-inflammatory. So it treats the symptoms. Yes, you'll probably leave there feeling a little bit better, but it does nothing to address the underlying cause and really fix the problem. If you go to some other practitioners, you may get work on the muscles or on the soft tissue, some massage, some stretching or exercise. That's important, but it certainly isn't the full thing of what needs to happen to really fix those injuries. So when we're addressing at Team Chiropractic any kind of extremity condition, we want to look at both the neurological component, so making sure the nerve supply coming out from your spine to that area is correct and working at 100%. We want to address the biomechanical portion, what we call arthrokinematics, which how that joint is positioned and how it's moving. Because if we don't do that, we're setting ourselves up for problems in the future. If you just take a sprained ankle and just rest it, use pain medication, anti-inflammatories, it will probably feel better after a couple weeks, but that joint isn't going to be moving correctly, it's not going to be positioned correctly, and you're setting yourself up for arthritis and degeneration down the road. And that's true really for any joint you want to talk about. Joints degenerate, extremity joints, just like spinal joints, degenerate because they're moved when they're out of alignment. So when you have an injury, you've got to get back into alignment. It's the key thing. So continuing with our treatment, we're going to adjust those joints for sure. We're going to deal with soft tissue however we need to, whether it be stretching, strengthening, a combination of both. We're going to support those joints, sometimes with rock tape or kinesio tape, sometimes with a brace. Other things that we can do to really speed that process along is the K laser. It's class 4 laser, is a great modality. We use that mostly on acute conditions, which will get people back to work, back on the court, back on the field, back exercising in the gym, doing what they want to do as fast as we can. So the laser is a tremendous help for that. And then we also, the newest modality we have here is our shockwave, which we use more for chronic conditions. That's that knee or that wrist that's been hurting you for 5 or 10 years and you don't think there's anything that can be done about it. Shockwave is great at going in, breaking up that old scar tissue, and we've seen tremendous results with that in those extremity conditions that are chronic and have really been around for a long time. A couple of supplements that can be really useful for this. Joint Complex is one of my favorite. It is indeed a complex, so it's made up of several different ingredients. The main ones being we've got the type 2 collagen, which is the best supplement to help regenerate cartilage growth. So that's in there. It's got MSM. It's got turmeric, which are both natural anti-inflammatories. A couple other things in there that really kind of replace several other joint supplements we used to use. You used to take 3 or 4 of them. That's all kind of within that joint complex. So it's very convenient, great supplement. The Ligaplex 1 is a good supplement for new injuries, really helps promote healing of strained sprain injuries. So that's something we take right away. Fish oil and turmeric are great natural anti-inflammatories. Everyone should be taking fish oil for a host of benefits. There's heart benefits, there's anti-cancer benefits. So that's something everyone should be taking to begin with. And then finally, Ligament Restore is a really good kind of ligament and tendon health supplement to be taking as a preventative. A couple things just kind of generally, we talked about how important it is to get that proper nerve supply to those areas where the injury is. And the reason is, remember, that nervous system controls everything that goes on inside your body, including, the healing of those extremity conditions. So we've got to get that nerve supply. Remember that only about 10% of those spinal nerves are pain sensitive, so you can have pressure and irritation on those nerves that are not producing pain. They might be impinging on the motor portion, which is about 45% that control the muscles, or the autonomic portion, which is also about 45%, which controls all those other things in your body that go on that you're not thinking about. So you can have pressure and irritation affecting those, but not yet producing pain. We also sometimes just adapt to the pain by shifting our posture, by changing our gait, by changing how we move a joint. And we know that when we move or change the way we move, the way our joints function over time, they wear out faster and they cause degeneration and causes some of those chronic problems. We're going to remember that all sickness and disease is caused by toxicities and deficiencies. The main deficiency is, remember, you've seen some of these workshops hopefully before, decreased nerve flow caused by subluxation. So we've got to correct that. That's always number one. We've got lack of prayer meditation, lack of essential nutrients, lack of sleep, lack of exercise. Those are, all part of those 6 essentials we're going to talk about. But a lack of those good things, those deficiencies, lead to problems. And then the other side of it, we have the toxicities. Bad diet, too much medications and drugs in our system, negative thoughts, environmental toxins that are around in the air we breathe and some of the other products we use. So we want to stay away from those for sure. And then live out the 6 essentials of health. This is the key thing, the most important thing that I think we talk about in any of our workshops to make us healthy and really build that health is, we start out with that spiritual, mental alignment, 15 minutes every day in prayer, meditation. We get our physical alignment. You're getting those spinal re-engineering adjustments and that mirror image position weekly until the x-rays are corrected. We're practicing good posture. We're doing our home care. We're getting our nutritional alignment, reading 75% off the vine. We're trying to limit processed stuff and artificial foods. We're exercising in alignment, at least 3 days of high intensity interval training, 3 days of strength training. We're resting in alignment. You should get enough sleep every night so you're waking up without an alarm clock, hopefully on your wedges, on your rolls in a good position. And then finally, we're removing chemical stresses. It's hard to avoid all of those things, no matter how clean we try to eat. So we do a detox twice a year. We have 10, 21, 28 day. There's different plans depending on where you are. And then drinking, starting every day, drinking a glass of water to get going and making sure you're drinking plenty of water as you go throughout your day. So I'd like to thank you. If you have questions, certainly about any specific extremity conditions, specific exercises. Obviously, I couldn't cover every possible extremity condition here and the specific exercises and strengthening that you need to do. So that's something to ask one of your doctors in the office. We'll be happy to work out a plan for you to make sure you're doing everything you can to get that condition healed and healed correctly. Remind you, you can watch this video and refer a friend for $47. That goes back to our ministry. And if you need a guest speaker, we'd love to come out and talk about chiropractic, about extremities, about health, or any other issue health related. Thank you very much.